Today I am here to talk about the most common blood disorder among the general population. Anemia is a deficiency of healthy red blood cells. It is caused by the lack of oxygen being carried to one's blood and hemoglobin. Hemoglobin is the main source of protein in the red blood cells needed to maintain homeostasis. Homeostasis is a state of balance within the body to function properly. There are over 400 different causes of anemia: cancer, heavy menstrual cycles, pregnancy, fibroids, sickle cell, vitamin deficiency, digestive conditions, and diet. Here I'm going to show you the first handout that I have of anemia. On the left side, we have normal red blood cells. The normal red blood cells are twice as many as the anemic red blood cells. They're more oxygenated and thicker in size. The anemic red blood cells, there's fewer and they're thinner because they lack hemoglobin and they lack oxygen. The second handout that I'm going to show you is the difference between healthy blood cells and sickle cell anemia, which is one of the causes of anemia. Healthy red blood cells, they're circle oval in size and they're thicker due to them being oxygenated. Here is an unrestricted blood flow showing you how the red blood cells go throughout our body. Sickle cell anemia is often moon-shaped. Sickle cells blocking the blood flow, meaning that they clump together right here at this site and they make it difficult to breathe and other things of that sort. There are different symptoms of sickle cell. We have the shortness of breath, dizziness or lightheadedness, irregular heartbeats, fatigue, yellow or palish skin, chest pain, cold feet and hands, headache, and weakness. On this side, it shows you what the normal red blood cells and white blood cells look like compared to someone who has anemia. These look like small red blood cells, but in fact they're not. They're pallets. People who often have anemia have more pallets and less red blood cells and less white blood cells compared to someone who is normal. There are treatment and prevention for anemia. There's medication, meaning iron pills, or if your anemia is too far gone, then you would need an iron transfusion. The second one is supplements such as vitamin B, vitamin C, vitamin D, folic acid, and things of that sort. And lastly, a change of diet. Here I'm going to show you some home remedies for anemia. One can eat pomegranates, fenugreek, tomatoes, whole grains, spinach, liver, beetroot, dates, nuts, peas and beans, bananas, and bottle gourd soup. All of these help with managing one's anemia. Anemia is more common among women and men than children. Women are twice as likely as men to have anemia. 2 out of 100,000 are most likely to die from anemia each year, while 800,000 people visit the ER for anemia. As men and women get older, 7.4% of men from the ages of 65 to 74 years old suffer from anemia compared to 7.6% of women from the ages 65 to 74. If one suffers from one or more of these symptoms, then they should take a red blood count test provided by their healthcare providers to determine one's hemoglobin and iron level. Personally, I suffer from anemia. I have to take iron deficiency pills. I have to eat a lot of spinach and green and leafy items, liver, red fish, seafood. I personally do not like liver. The taste of it is horrific, but if you like liver, that's perfectly fine. It's just not my taste. So I prefer seafood, fish, beans, spinach, and things of that sort. I also have a problem with shortness of breath, and I get cold and hot quicker or not as less likely as other people, if that makes sense. So sometimes when it is 69 degrees outside, I will be shaking and shivering because I am colder than they are, even though the temperature isn't that low. Or sometimes if it's 79 degrees outside, I will sweat profusely because that's just how my body is. My body has a trouble regulating compared to people who are normal and do not have anemia. Another thing that I suffer from is headaches. I always have headaches. They're more like migraines, and I take Advil, Tylenol, and things of that sort. But I also make sure that I go to the doctor yearly if I have any problems, and I get retested, and my medication and my change of diet and things of those sorts will either get bumped up or decreased depending on how my body is. Thank you.